Hi.
Hi.
Could you start by giving me your first name and then just a little bit about you?
Okay, so my name's Diane. I'm a retired registered nurse. I'm 68 years old. I'm married. I have 3 children. My oldest are twins, and they just turned 30 this week, so I'm feeling really old. What else would you like to know?
What are some of the things that you like to do in your free time?
Since I've retired, I volunteer for a nonprofit organization that helps seniors age in place by providing services that they need. So we do a lot of things like driving them for hair appointments or doctor's appointments. I'm an old nurse, so I have one lady who can't see. She's 98, and I go every month and set up her medication for the month for her. I have another lady who's 98 who likes to play Scrabble and likes dogs, and I have a 100-pound golden retriever. So Max, the retriever, and I go once a week. We play Scrabble.
Aww.
She likes to pet the dog. She likes to play Scrabble. With a little bit of help, she can beat me, and I'm a pretty good Scrabble player.
Wow, that's so nice.
When I retired, I joined the Y. So I go to the Y 5 days a week and do water aerobics, and I've made a group of friends there. We're all now very close. It's been several years, and same people come all the time. So that's fun. I love to hear about my kids. I love to cook. I've taken a lot of cooking classes. I've taken classes, French classes. My youngest daughter lives in Paris, and I want to keep up with my French a little bit. I'm not very good, but a little bit's better than nothing at all. My family was French-Canadian, so we spoke French at home before we did English, but you wouldn't know it now because I don't use it. And I took French in school, so it's trying to keep all that going, I guess.
Yeah, you sound like you keep very busy.
I do keep busy. I don't know how I had time to work before.
Okay, and now would you be able to tell us about your experience being diagnosed with breast cancer?
Well, I was 55, so it was a while ago. It was a total surprise. I was working then. I'm a nurse executive. I had a high-powered job and very busy, and 3 kids. The oldest were in high school then. It was the scariest thing I've ever had happen to me. Totally unexpected. I had skipped a mammogram for 1 year and then had one the second year, and when they said they thought it might be breast cancer and they needed to do a biopsy and all of that, it's like I couldn't believe it. I thought it was really just couldn't possibly be true, and one thing led to another. And I did end up having the biopsy and then having a lumpectomy. And I had chemotherapy and then had radiation.
Oh, wow.
And I've been fine ever since. So it's, 13 years now. And thank God, everything's been fine. I do have a family history of breast cancer. So I have a niece who was diagnosed when she was in her 30s. Very young, misdiagnosed, and by the time they realized that she had breast cancer, it was already spread everywhere.
I know.
And she ended up with liver cancer, and one thing led to another. She passed away when she was about 40. So that was scary, and then it was scary because I was concerned that perhaps I carried the gene. And if so, then that would have implications for my girls. So we did do the genetic testing, which thankfully was negative. And after that, actually, my niece's mother, my sister, was also diagnosed with breast cancer.
Oh, wow.
So it is in the family and something to be concerned about, something the girls need to make sure their doctors know and that they can follow up with.
At what stage were you diagnosed?
It was first stage,
First
so
stage.
It was small, it was localized. Had it been picked up on the mammogram I missed, I wouldn't have had to have had chemo and radiation, they would have just done the lumpectomy. It was just big enough, which is only about yay big, that I needed to have the whole kit and caboodle.
And how long did the chemo and radiation last for?
The chemo was over a couple months, every week. And the radiation, I think, was like 14 times over a period of time. So I worked throughout all of that.
Wow.
After the chemo sort of has a progressive effect, so the first few treatments aren't so bad. After that, you're tired, and I would call in right after chemo for a day and then go back to work the next day.
Wow.
So,
Were there any other symptoms that you had to deal with from the chemotherapy besides fatigue, or any other things that you had trouble doing during that period?
They told me I would lose my hair. So rather than wait and have that happen, I'm the kind of person that likes to take charge. So I went and bought a wig, and I went to my hairdresser, and we shaved off the hair, and she styled the wig, and actually it looked pretty good.
That's nice.
It was more hair than I've ever had in my life. So the hair loss is something odd, and then you lose like eyebrows and eyelashes and things that you don't think about. You know, you go to put mascara and there's nothing to put mascara on. I lost my sense of taste in between the chemo treatments. So you have a treatment, and then within like a day or so, your taste buds are gone, and then they would just start to come back, and it'd be time for the other treatment. So it would take about a week. And the only thing I could really taste was a spicy marinara sauce. So we all ate a lot of spicy marinara during that period of time. Some fatigue with the radiation, and after a while, your skin kind of crisps up. It's like putting it in the broiler. I don't know. And it turns kind of black and crispy. It's the only way I can describe it.
Your skin all over your body, or
no, just at the radiation site at the breast. And that's a little sore, and it's weird, but you know, wasn't for very long.
That's good. Yeah, thank God that they were able to catch it early.
Yes, absolutely.
And did you receive any therapy during this period?
Therapy?
Any like occupational or physical therapy?
I did not. Now, as an old nurse, I kind of thought I could do it on my own. And I had a good support system with my family and my friends and my coworkers. So I had lots of support.
That's good.
I did not do any kind of formal therapy.
Could you talk a little bit more about your support system and who they were and how they are able to help you?
Well, I think just family, being supportive there for me, listening. I have some very close friends that I've known for years and years and years who would bring over meals if we wanted, or just come and sit with me at chemotherapy just to be there and present. People who would call and just check up. So I felt like loved, and I felt supported, and felt like there were people there that I could call if I felt badly or depressed or needed help with anything. And my husband's great, so, you know, it worked out well.
That's nice. And then, how did the diagnosis affect your family?
Well, I think for the kids, the older kids, I think I don't think they realized how serious it was, really. I don't. The younger one, how old was she? She was in middle school. And she's very anxious about things anyway. And she had a hard time just with the fact that I was sick. After the chemo, you didn't feel good. There was one point at which I felt like I was going to faint, and she was the only one home with me. And I remember telling her, I really feel like I'm going to sit down. If I black out, you know, just wait a minute, and then you could call 911 or call Papa or do whatever, but I'm going to be okay. I just feel like I might do it. And she just couldn't handle it, ran shrieking from the room, slammed the door into her bedroom. And I thought, oh, great, right? This is not going to work, but I was okay. She also was very concerned about people's reactions. So the big kids didn't care about the bald head, and I didn't wear the wig except to work unless there was some reason to, because it was hot and uncomfortable. Big kids didn't care if I took them someplace and I didn't have any hair. She did. So with her, I didn't want her to be embarrassed in any way. I understood it was different and scary. And for her, I would either wear the wig or wear a hat. And I remember sitting out at soccer games with, a big hat on just to be sure that she wasn't embarrassed in some way.
Wow. Yeah, it's interesting how a diagnosis for you really affects everyone around you.
Well, it does, and it impacts the normal way things you're doing, things you normally do at home, or things you'd spend time with them with, your energies being put into something else. Or I'm not somebody who's laying around in bed, you know what I mean? Or I'm active and on the go, and it was different. So they were busy. They had school and their activities and their friends and everything going on, but it was a change in the household and how things were run. Dan would do a little more of the cooking, or more of the housework or the shopping or stuff that normally we would share. So.
Yeah, you said that you continued to work during all of this. So
I did.
Where was the areas in your life that you had to cut back on?
Well, I think I just did what I could at work, tried to be well prepared, and tried not to overdo it. But there were things in my role that weren't easy to just let go. So I just did those, and if I was tired, I'd go home a little early or go in a little later, or try not to rush around and do 35 things in a day, instead of work in the grocery store and, cooking dinner and whatever. You try to simplify things a little bit and try to kind of ease up a little on the pace.
Did your experience as a nurse, do you think, change the way that you handled this experience?
I think so. I think I was probably better prepared intellectually, maybe not emotionally, because it's still a shock.
Yeah.
And it's scary. I remember driving home from the doctor, you're just scared to death. It's scary. But I was aware that I needed support and that there were people who could provide it. And I was aware that I was having emotional reaction to both the diagnosis and the treatment, and that I needed to kind of just stop and breathe and kind of let that percolate, understand what it meant, and then figure out how to keep going with the things that were the most important to me. Now, my experience was as a psychiatric nurse, so I've been a psychiatric nurse my entire career, and I think that's helpful in terms of the emotional stuff.
Yeah. So going off of that, what are some of the coping strategies that you used during that period?
I tried to simplify things and slow down a little, change the pace. I tried to take a deep breath and keep things in perspective. Having a lumpectomy didn't mean I was dying tomorrow. You know what I mean? Keep in mind the realities of the statistical stuff. I mean, most people who are caught early and it hasn't spread and all of that do just fine. I tried to get as much information as I could from my doctors, my oncologist, the surgeon, all the folks that were involved in my care. And for me, the more knowledge and information I have, the better I feel. I know not everyone feels that way, but for me, it helps me feel more in control.
And then, are there any residual effects or symptoms that have lasted after you finished the treatment?
Well, everybody else I know that had chemo ended up with this big head of curly hair. No, I didn't have a lot of hair to start, and I didn't end up with a lot of hair at the end. Darn, that would have been a benefit. Other than that, I just have a funny little scar on my breast where they did took out the little tumor.
Mm-hmm.
And no other side effects.
That's good. Good to hear.
It's been a long time ago now.
So, in general, how would you say that having breast cancer has changed you?
Well, I think it makes you think about your mortality in a way. Having a serious illness makes you think about, wow, this could happen. I'd never been somebody who was sick before, so it's kind of a wake-up call to think about what your priorities are and all of that. It also made me think about the girls and what impact it could have on them. When they did the genetic testing, they had asked, would I be willing to have a hysterectomy if the genetic testing were positive? And it didn't really occur to me that the genetic testing had an impact for me. I really thought of it only as information that I needed for the girls to have. It just makes you think about all the possibilities, I guess.
Mm-hmm.
Other than that, it's scary, but we got through it.
Yeah.
So you can get through it, and you can keep going, and things don't have to change that much.
Mm-hmm. And now you're stronger because of it.
Well, I suppose so. I suppose so.
So are there any challenges that you still face?
Not related to that, really. The first few years it's scary every time you go get your mammogram, and at first they do it every 4 months, and then every 6 months, and then now it's annual. A lot of people my age, I guess, don't have to have annual mammograms anymore, but I do, because there's a higher risk. You want to be careful. So that was scarier initially. Every time you'd go, you'd hold your breath until they came out and told you that everything looked okay. And they also would do blood tests that was a cancer marker. Not to say that if it's positive, it's not to say that you necessarily have cancer again, but it's a marker that indicates it's a possibility or likely. And I'd have to have those blood tests every time I went to the oncologist. And then every time you go to the oncologist, you have to think about it again, I guess. You sort of rethink what you went through, what it was like, what it could mean. Could it be, oh, that's scary.
Yeah.
I don't want to do that anymore.
That does sound really scary.
Thankfully, as time goes on, that gets to be a little more of a distant memory, and you're able to say, oh, I'm a cancer survivor, it's been 13 years or whatever, so it feels a little further removed.
Mm-hmm. Do you have any advice for us colleagues and the people in the class on how to provide better client care for people in your position, or really just any client that we will encounter?
Well, I don't know, everyone who helped take care of me, and it wasn't an OT, I'm sorry to say, but was very attuned to what I might be feeling, wanting to be supportive, wanting to provide information. I think as much information and teaching and education as you can give, the better. And then I think kindness and emotional support goes a really long way with all of us in everyday life, no matter what we do, but in that situation particularly. I had a nurse who was with a radiation clinic. It was at UCLA, and it was like a clinic, and the doctor prescribed the radiation, the nurses would check on you when you check in, and the doctors would check on you once every little bit. But this particular nurse was very, very kind and saw that like I was bothered by the skin changes and that it was painful and whatever. And she went to Target and bought me an undergarment that would be more comfortable.
Wow.
And brought it for the next time that I went in. It was really totally above and beyond and made me feel like, oh my God, she really cares. I mean, not that you have to go out and buy undergarments for your patients, but it was just a step beyond in terms of her being aware that I was uncomfortable and wanting to provide something that would be helpful to me.
Sounds like you had really good care.
I did have very good care.
That's great to hear.
Yeah.
Do you have any other comments or things that you'd like to share with the class?
No, but when you say with the class, I'm immediately intimidated. To share with you, Emma,
yes.
I can't think of another thing, except that be aware how scary it is for somebody. They might not look scared. I'm pretty good at a stiff upper lip and looking like I'm in control. I was petrified. And sometimes maybe trying to elicit a little bit of that would be helpful for a client.
Yeah. That's really good advice. Thank you.
You're welcome.
Okay, I think we're wrapping up then.
Wow, that was quick.
It was. Thank you so much.
You're welcome. It was my pleasure.